community.
Well, which brings me to the issue of funds, for the agency NACA. You talk of all these policies and programs and what the agency intends to achieve, but you ask if these funds are really available for NACA to be able to implement. So what can you tell us about that?
Well, I would say I'm lucky, but we still have issues. Since I came in here, we have had a good inflow of funds from donors, particularly from the US government, from the Global Fund, from the World Bank. When I say lucky, we've worked hard at it because these things just don't fall from the sky to you. You've got to do a proposal, you've got to justify it. And as we speak this week, we've got the World Bank, we've got the Global Fund, we've got USG coming from Washington and Geneva. They're all, in fact, in the next, as I leave you, we're going to have a big meeting with all the big guys from the Global Fund. So we're very, very grateful to them. But there's a but. In the last 3-4 years, there is declining and a plateauing of, foreign funds from donors. And you and I understand this. The economic climate in the West is very bad now. So many of them are no longer even supporting. And those that are supporting are actually reducing, So they're telling us that we need to look inwards, particularly looking at it, with the broad view of the MDGs and the post-2015 agenda. And it's a huge recommitment to say, look, we know that the funds coming from the donors is declining. We need to put in a lot more. Secondly, we also know, and I'm speaking on the declaration now, all this 70% of the funds that come in here actually go to buy the commodities, drugs, test kits, condoms, etc. Why can't we produce some by ourselves? And in doing so, we will transfer technology, we'll give more employment to our people, and this is more sustainable. So, and then to cap it off, our president launched his plan, the president's comprehensive response plan on HIV/AIDS. And this is the first African head of state to actually develop his own plan. The plan that we've been using, we saw one from President George Bush. That's the PEPFAR plan. This is the first. And we are going to UNGAS in the next 2 weeks to go and amplify that, the Abuja plus 12, and perhaps, the plan that our president has launched. Because it's a good example for all Africa.
Now, finally, Professor, before I let you go, because we're really running out of time, and that has to do with, the manpower or the personnel that is available, at your disposal, talking about NACA, in order to carry out all of these targets that you've talked about. Of course, you made mention earlier, that there seems to be some challenge in that area, but how do you intend to address this?
We're actually doing that now. We're actually engaging very high quality staff here. We even have been able to establish a department for resource mobilization that's looking at all those. And as far as the whole country is concerned, we do not need to reinvent the wheel. Many of the things we do in HIV, they are not rocket science. So we need to task shift and task share. And examples of this already abound. If you go to a very busy clinic, I used to run a clinic, before I came here in Jos, where we had 15,000 people, accessing care in that clinic. And on a clinic day, we used to get 400, 500 people with about 5-6 doctors. And then you find you cannot do everything. The question is, what can the doctor, give the nurse to do? And what can the nurse give to somebody else? So if you shift tasks that way, for example, if you were stable and you didn't need any complications, you didn't have any complications, you didn't need any evaluation, the nurse can write your drugs, because it's just like, similarly, there's so many things, counseling, etc., which the layman can do now. I just told you that in many parts of Africa now, you don't even need to be a medical person. You can be trained to test people. Because it's a question of looking at changes in color of things. And you say this person is positive, it says, and then you have other tests that will even help to guide you to ensure that the thing is confirmed. So I think we all agreed now that that's the way to go. In our new plan, we want to double the number of people on drugs. We currently have about 500,000 people on drugs out of 1.5 that need it. We want to go to 1 million in the next 2 years. We don't have all the doctors. We don't have all the nurses. So there are things we have to do out of the box. I think that all of us understand this, and we have a new guideline by WHO, which actually is, promoting that. We have to do that. And if we don't want people to die of HIV, if we don't want to have new infections, and if we want to bring down the level of stigma and discrimination, we have no choice but to do that. All of us have to be, some kind of expert, in quotes.
So in other words, you're saying that everybody indeed has a role to play. It doesn't matter whether you're a health worker or you're just a layman. We have to do what we can to ensure that HIV and AIDS is well, brought under control, if not totally eradicated. Well, I guess we'll just have to end it there. Professor John Idoku, we thank you so much for spending time with us on Question Time.
It's my pleasure.
Thank you
very much. Thanks.